We're here in San Diego this afternoon at the 2016 American Society of Hematology Conference, and joining me this afternoon is the CEO of a company called Erytech, Beyen. Gilles, very nice to see you.
Nice to see you.
So a lot of interesting things going on in the area of oncology and cancer, and your company is really on the leading edge of science. Can you tell our viewers what your company is working on?
Yes, our company Erytech, what we do is in fact we put drugs, molecules into red blood cells. Red blood cells, you see a lot of that here at the hematology conference. And so what we do is in fact we take drugs that, as you know, typically a lot of the chemotherapy and the drugs used in oncology are quite toxic. What we have is a technology to put drugs, so we take red blood cells, we make them open up their pores, drug can enter inside, we close again, and by doing so we have developed a drug that has a longer activity with less toxicity associated. It's using a well-known molecule in leukemia space. It's called asparaginase. So we put the asparaginase in the red blood cell, and what we see indeed is that we have a longer acting with less allergic reactions and a better safety profile.
So you're taking that red blood cell, you're opening it, you're putting in your product, that cell is then closing and then going off to fight the cancer.
Exactly.
So how do we get your product into those red blood cells?
That's the core of our technology.
That's the secret sauce.
That's the secret sauce, but it's quite easy to explain. In fact, red blood cells are cells with a very flexible membrane. What we will do is put these red blood cells into a medium with low saline content, low osmotic pressure, which makes that these cells will start swelling and water will enter inside. And at a certain moment, pores will open up on the membrane of the red blood cell. And that's the moment when the drug can enter the red blood cell. And once we have reached desired concentration inside, we will add salt. It's not correct. We will change the medium more with a higher osmotic pressure, and these cells will take their original shape, and then we have the drugs encapsulated inside the red blood cell.
So we're hearing a lot, as I mentioned, about personalized medicine. So when you put your product into that red blood cell, is it the same for every person, or does that depend on each individual person's red blood cell and what that cell looks like?
Somewhere in between. What we will do is, especially in the leukemia space where the red blood cells of the patient themselves are not in too good a shape, so we will start with red blood cells that we buy from the blood bank, but still it's personalized because we need to match obviously with the patient's red blood. So what we will do is when the prescription comes in, the blood type of the patient needs to be specified. We will find the right bag of red blood cells matching the patient we are going to treat, and then produce the product with always the same molecule inside, but with red blood cells that are matched. So indeed, it is a form of personalized medicine.
Sure. It's fascinating science. So where are you in the process with your product? And when can we expect to see this being delivered as standard care for patients?
So first, we're a European company, and our trials have started in Europe. We're based in France. And in Europe, we have done the phase 1, the phase 2, and also now the phase 2-3, the pivotal study. And we are in the process of filing for European registration. So filing next year, and it typically takes about a year to get the approval. So our first approval could be in the course of 2018 for Europe. In the US, we're in the phase 1 study, but catching up rapidly and hopefully around the same, or a bit later then, but also bring the first product to the US. But we're already doing the study in the US also.
Now, I know, in the U.S. with the FDA, they're really trying to accelerate the approval process. Of course, we have to test, and we have to make sure that efficacy is there and everything is, safe, of course. But do you think you'll be able to fast track your product in the U.S.?
This is a question we still have to address. It is a high unmet medical need. The leukemia we have an orphan drug designation already, both in Europe and in the US, for acute lymphoblast leukemia and for acute myeloid leukemia. So already that is an important element, and then yeah, the process of fast track is still to be, we're still in a too early stage to tell, I would say, in the US.
Yeah, well, we will certainly keep an eye on it, and we wish you all the best, and thank you so much for stopping by and sharing the good news with us.
Thank you very much.
Thank you. Thank you.